All right. So this chapter, abdominal injuries, we're going to buzz through, at least get part of these notes done. So then you can, we have less to do next week because we got to make up what we don't get done, because that's what we do here. So I've started investing in stocks, beef, chicken, vegetable. One day I hope to be a billionaire. Huh? It's a double-layered dad joke. Come on. All right. So the abdominal area, right? We know what the abdomen is. It's between your thoracic cavity, which is where your diaphragm is, and the pelvis. We know what's in there: digestive system, urinary, genitals, etc. So soft area, susceptible to trauma. Not a lot of bone structure, right? So blunt, penetrating trauma, whatever can happen there. Okay. So divided four quadrants. We talked about that, right? We always want to identify pain, tenderness, swelling, whatever. Identify it by quadrant. Okay. It can help us, but more importantly, help medical staff at the hospital determine what is going on, right? Right lower quadrant, swelling, inflammation. That's where your appendix is located, right? And also where your descending colon is at. So it's a fairly common place for pain, swelling stuff. Hollow organs and blood-filled solid organs. We've talked about those. The hollow organs contain waste, right? And so when they rupture or lacerate or otherwise opened, they release bad stuff in there. It can cause inflammation and infection. Okay, so when an appendix ruptures, right, that's what happens. Or when you've got a rupture of one of these hollow organs due to trauma, that's what happens, right? If it does rupture, the mesentery or the lining, essentially, what connects to the wall, that's where the blood supply is at. So pretty easy to bleed. Okay, about anywhere. It doesn't have to be a solid organ rupture to bleed. Okay. There they are. You can see. I know we talked. Take some time to look at this. We talked about what's located where. Okay, stomach and spleen on the left, liver on the right, gallbladder's in the middle. Right. You can see where everything else is here. But take a second to look at that. What's located where? Pancreas, is also on the left. Take a second to study that a little bit because it's going to help you with that right and left-sided pain. All right. Solid organs, the liver, spleen, pancreas, kidneys, those are very solid, full of blood, full of not blood, full of vasculature, full of arteries and veins. So if they rupture, that's not good, right? Ruptured spleen is liver and spleen can cause severe. A lot of times when people die from internal bleeding from car accidents or other trauma, it's liver and spleen. Okay. Abdominal injuries are just like always, open or closed, right? If they're open, you can see the stuff. If they're closed, you can't. Okay, blunt trauma can be caused by a variety of things, right? This is why kids are supposed to wear a booster seat, etc., right? If it's across the abdomen, that can cause issues. Being run over or struck by a vehicle, being hit by a baseball or hit by assault, a bat, whatever. Blunt trauma to the abdomen can cause closed, right? Pain is often diffuse and it might be referred pain. Okay, you might feel it in a different spot. And I can't remember off the top of my head, but pain in your appendix is felt not only in that area, but also referred in the left arm. But regardless, a lot of times abdominal issues can cause referred pain, which is elsewhere. Okay, so just because there isn't pain in a certain area doesn't mean there's not something going on there. Okay, and blood. Oh yeah, blood irritates. Okay, so blood anywhere in the cavity is going to irritate all over. Okay, blood irritates, and that mesentery, that lining gets irritated. The peritoneal lining gets, and it causes pain globally or all over the abdomen. Okay, so difficult to locate the pain. Right, can be. We just talked about that. Guarding, if they stiffen their, like when you're palpating and they flex, right? They stiffen up the abdominal muscles. That's a protection. Your body's protecting that painful area, right? So guarding is definitely a symptom, right? Or a sign, I should say. Abdominal ascension. If there's something swelling or blood flow, the abdomen in a certain area might start to stick out a little bit. Okay, you might see bruising, discoloration. Okay, you might not. Okay, if there is damage to that tissue where the blood's collecting, you might see it on the outside. You might just see abrasions where the actual impact happened, but just beware of what might be underneath. Seatbelts, they prevent injury, save lives. They're definitely necessary, right? But if the belt isn't sitting in the right spot, it can cause issues. Okay, pregnant women and otherwise. Okay, you see that there. So where do we want it? We want it across the hip bone, right? Shoulder, hip bone. Okay, if it sits too high or sits too low, okay, it's going to cause issues. See, there's that where the belt comes across. Okay, it's kind of low across the hips. That's where you want it. That's why we put kids in lap belts. Open injuries, it's caused by a foreign object, right? We don't get open injuries from, it's not like a broken bone that might protrude through. Generally, it's got to be a penetrating injury. Okay, open wounds can be deceiving. There it is. Okay, open wound to the abdomen. We don't know exactly what got hit. Right, so we got to know. Damage, low velocity injuries, knives cause damage, but usually not horribly extensive. Smaller caliber handguns, shotguns, where the bullet's not traveling as fast, they're kind of a medium issue. In this, high-powered rifles. Talk to any trauma surgeon about high-powered rifles. To a person, anybody who's ever worked on a shooting victim from high-powered rifles will preach of their evils. They create a phenomenon called cavitation, where basically the shock wave causes the expansion and contraction of the target of what it hits, and that expansion and contraction basically liquefies the organs. So that's bad, like bad. So without getting into politics, that people that respond to if you ever have to respond to a mass shooting incident with an AR or other high-powered rifle, those people don't have much chance. So that's that cavitation thing. Low velocity injuries generally aren't as severe as imminently life-threatening. They're still severe. They still could kill them, but usually it's not instantly dead. Okay. Evisceration, that's if the ball protrudes, right? If you've got something sticking out, it looks disgusting, right? This is where we cover it up. Here goes the ambulance. But like I said, you don't sit and stare at it. You look at it, you see what's there. If you can possibly identify what it is, cut away clothing. Don't pull on it. Don't push on it. You're going to cover it with a moist. You're going to cover it with a moist. Come on, click here. Dressing, right? Tachycardia, right? Your body's going to jack it up. You're basically going into shock, right? So be looking for that. Signs of bleeding, signs of shock. Hollow organ injuries, right? They rupture. They don't bleed a lot. The stuff spills out, and eventually the acid or whatever's in there not only will irritate the bowels, irritate your guts, but will also start becoming infected. Okay, generally a later injury. Hollow organ injuries can be caused by any type of injury, right? It can basically pop them, right? If there's pressure, force against it, or they can, a penetrating injury can go through, right? And very painful for a variety of reasons. Solid organ, right? They bleed a lot. Okay, so if there's any reason to indicate solid organ injuries or internal injuries at all, get them going. Okay. The liver is big. The liver's quite big. Anybody, if you're a deer hunter and you've ever gutted a deer, they're big. And so they're big, so they take up a lot of space. They're easy to injure, so you don't get oftentimes a lot of bleeding from that. Okay, right inside the ribs, so they fracture too. Spleen and pancreas, same thing. Diaphragm. The diaphragm, if that gets split, it's you can't breathe. It's hard to breathe, right? If it gets penetrated. Also, bowels, right? Your intestines can protrude through there, just like that evisceration they're talking about can happen up there. So, hard to breathe and obviously imminently life-threatening. Okay, kidneys hit in the back. They're kind of protected by your ribs, kind of not. In the back on each side, getting hit there can cause obviously rupture also. You'll oftentimes see bleeding in urine as a result. Okay, so be on the lookout for that. If somebody, they may have not urinated, but if they had, you might see that. Assessing it, again, we might not know why, right? Abdominal pain. Oh, they're cold. You might have to ask, is there any chance, was there assault? What happened? What caused this? So just be wary. High index of suspicion on these. Seen safe. Depends what causes, right? Did they fall? If they fall, they need spinal precautions, yada, 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 right? If they fell, there could be a variety of things, right? Just like always, we're on the alert with depending on the mechanism. Okay, rapid scan, right? There's probably not a lot you're going to be able to do about it, so it's not going to sit. You're going to assess just like you always do, right? You're going to palpate the 4 quadrants. Okay, so in this one, I have a little bit of a problem with. Okay, we don't know what injuries are in there. Okay, so poking and prodding more isn't exactly going to do you any good, right? So we're not going to go. We're going to do our assessment. We assess where the pain is, what's going on. We ask our questions. We get them going, right? Because we don't know what's under there. Just like always, check the airway. Make sure the airway is there. Circulation. Looking for shock. That's really all we can do, right? Shock and maybe distension. Transport. Get them going. Okay. Clarify the chief complaint mechanism. Just like always, ask them what happened. Ask. You got hit. Hit with what? Hit where? Clarify a little bit. Okay. Sample history again. It's abdominal pain, right? Obviously, if you're called immediately, they're not going to have this. But if it was a day ago, 2 days ago, if you had diarrhea, what does it look like? Okay. Is there blood in the urine? Is there blood in the stools? Right. So you're going to be asking about that. Have you urinated? Right. If their kidneys are ruptured, they may not urinate much. So get them going. Decap BTLS, yada yada, same stuff. So palpate away first, right? Start, if they say, oh, pain's down here, you're going to start at the opposite, work your way in there because you know it's going to hurt, right? Life threats, if there's something you can treat, do it, right? We can't do anything with internal pain, but if there's bleeding or anything external, take care of it, okay? When you palpate the quadrant, if there is pain in the back, you can palpate the back kidney areas also. Keep checking vital signs. Right? If they were hit, like if it's an isolated injury, they're hit with the baseball bat across the belly. I keep referring to that. There's no reason to cut off their clothes and check everything, right? But you do want to expose the area you're looking at. Reassess, check everything you did, check for shock, right? These are becoming more and more repetitive as we keep going, right? What do? Closed abdominal injury, right? We don't know. You got to go in. They're going to do ultrasound. They're going to check. We're going to treat them for shock. Treat them for shock already, right? Treat them as if they're going to go into shock. Give them oxygen, okay? At the first sign of hypoxia or shock, but lay them down, keep them warm, get them going. If they need oxygen, give it to them. Treat them like they have shock, right? Blunt abdominal injury, put them on a backboard to protect the spine, right? Depending on, again, mechanism. If there's any chance to suspect spinal injuries, protect the spine. Open injuries, right? High index of suspicion, right? Blood loss, something was in there, right? Look for exit wounds, entrance wounds, depending on what that is. Dressing, I've always heard moist. They've always taught us moist because it won't stick, but a sterile dressing, whatever you have for sterile dressings, you're going to put on that abdominal wound, right? You don't want to put it. We all have various types of sterile dressings versus non-sterile dressings, so put a sterile dressing on it. Okay. If the object is still in there, just like always, stabilize it, wrap it up in place.